Colorectal cancer is the second deadliest cancer in the world. In 2020 alone, there were nearly 1 million deaths from colon cancer. Cases are rising, especially in people between 40 and 49. A colonoscopy remains the gold standard in detecting and preventing it, but hospitals like Mayo Clinic are working with a new minimally invasive options. Now, Dr. Johanna Chan is a gastroenterologist from Mayo Clinic and joins us this morning. Dr. Chan, thank you for being with us. I want to ask really quick, first let's talk about risk. Who's mostly at risk for colorectal cancer?
Yeah, thanks for having me. The short answer is that everybody potentially is at risk for colon cancer. Historically, one of the biggest risk factors is increased age. Although, as you have pointed out, we are seeing colon cancer in younger and younger individuals. And then there are certainly individuals at higher risk, like those with a family history or those with an underlying GI condition like inflammatory bowel disease, for example.
I mentioned 2020. That's when this disease was kind of brought into national attention when actor Chadwick Boseman passed away from colon cancer. And I want to talk about this new, some of these new screening options. Walk us through some of the changes to the screening protocols and what it means for people with these risk factors.
Absolutely. You know, as you had pointed out, that was a very high risk case and a high national publicity. But what it really highlights is that there are certain younger patient populations. We're seeing an increased prevalence in patients under the age of 50. And certainly the national guidelines have been changed to reflect some of those changes in prevalence. We now recommend universal colorectal cancer screening at age 45 and above. Previously, 50 used to be sort of the magic number. And so now ages 45 and above, anybody, even without a family history, even without any sort of risk factors, that's the new age for recommended universal screening. And there are a number of different modalities to complete that task of screening.
How important is a screening? Like I'm 32, so maybe I have a little while before I need to start thinking about this, but how important is screening with regards to prevention?
Colon cancer is one of the most preventable cancers that we screen for. By that, I mean, not only are we potentially catching, let's say, large lesions or tumors quicker by having a routine screening, someone who has no symptoms. If we actually find what's called a polyp, a little wart-like lesion in the colon, before it's developed cancerous or even precancerous changes, the goal of the colonoscopy is to find and remove all those polyps, and then they never get a chance to even grow into cancer. So we can actually prevent colon cancer with something like a colonoscopy, one of the methods for screening. And more importantly, some of the early colon cancers, if they're small enough and in situ, meaning kind of just in place in the colon, we can actually cure colon cancer by resecting these lesions when they're small.
And talking about what I mentioned about the minimally invasive options that are available, Mayo Clinic's doing some work with AI. Can you talk a little bit about that?
Absolutely. You know, these are a lot of new kind of discoveries and new technologies coming down the pipeline. There are some minimally invasive modalities for screening, as you mentioned, stool-based testing, for example. Not everybody is going to be a candidate for those types of screening. Some of the work that we're doing at Mayo Clinic with AI, artificial intelligence, is really new and exciting. We've all heard about facial recognition software where, you know, the video scan can be screened for certain patterns with an algorithm. That's really how AI works in real time during the colonoscopy. So as the physician's performing the colonoscopy, this AI software is running in the background, looking at the screen, potentially alerting the doctor to any sort of unusual patterns or specific features that might represent an abnormality. And the AI software can point that out for the doctor to pay specific attention to. And we've seen from studies that AI can improve that polyp detection rate by up to twofold. We are offering this at the Mayo Clinic sites, and it's a really exciting addition to the work that we've been doing for years.
Dr. Johanna Chan with Mayo Clinic, thank you very, very much for joining us this morning.
Thanks for having me.